Hello, Internet. Ken here, back to do some conversation with you guys. I am a stage 4 cancer survivor, diagnosed almost exactly 3.5 years ago, and been through a lot of stuff in these 3.5 years. Unexpected and unpredictable, and including the fact that I am still alive and breathing on this earth is something that we were not expecting back when I was first diagnosed. So again, I spent a lot of time in the last video on this, but I'm trying to be deliberate about identifying myself in the beginning of these videos for those of you who are new, because I'm having, I don't have a huge viewership, but compared to what it was a year or two ago, there's a lot of newer people. So if you want more information, more details, more of the backstory, there are 70 something videos on my channel that you can go and look at. And that's what I did back in the beginning when I was first diagnosed. I remember I latched onto a few YouTubers who I really enjoyed listening to that had a similar diagnosis, prognosis. Unfortunately, many of those people are no longer with us. Some are that I continue to follow. But the point is, I dug through dozens and hundreds of videos of some of my favorite cancer warriors, and it helped me so much. People who had gone through similar things that I was going through, and then also watching people who were 1 or 2 or 3 or 5 years beyond me and how they were dealing with things, and even people who got into the actively dying phase of their disease. And some people in my family are like, why do you watch that stuff? It's morbid. It's not positive or encouraging. And I was like, yeah, but it's real. And I want to be real about what's going on with me. It's not, rainbows and unicorns all the time. I want to know what it's like when people are seeing the end, when their treatment stops working, when the things that used to prolong their life and health stop working, whether it's surgical interventions like ablations or radiology, or whether it's just traditional chemo, immunotherapy, targeted therapy, infusion, chemical-based treatments. Because so many cancer, I always struggle with this, cancer what? Survivors, warriors, cancer victims, cancer whatever. Those people, they all have different stories, and they all deal with, the longer you live with cancer, unfortunately, most people start to run out of options. The doors start to close because things aren't working the way they used to work. The disease finds a way around this stuff. Now, that's not always true, because another cliche that I've lapsed onto is the longer you live, the longer you live. That's because there are constant forward progressions in the research and the technology and the medicine. And the longer you live, every year or two you live longer, the more clinical trials become more mainstream, the more drugs that are in those clinical trials become accessible to everybody. And even just the skill of surgeries, surgical interventions. As you guys know, I have a total colectomy that happened 3 years ago. And also I had a 2/3 resection of my liver. Those are surgeries that were much more difficult a couple of decades ago. And now the technology has improved. Even my ablations, some of you that have seen the videos, like I've had 3 ablation procedures where I'm completely knocked out and they go in with these needles and they either fry or freeze certain lesions. They have to be a certain size for them to do that. But even that technology has just exploded and raced forward, even in the last 7 to 10 years. So I guess you can look at it both ways. The longer you live, the more your disease tries to outsmart the medicine and the technology. But also, the longer you live, the more sophisticated becomes our medicine and technology and surgical, procedural interventions. So anyway, this is one of those videos where I'm kind of rambling. I tend to do that. As you know, I hit record without an agenda. I don't have a script. It's just that I want to talk to you guys and update you. So let's see, we were 6 minutes in. I had treatment again yesterday, 7th round. So I have never gone as far as 7 cycles. We have always stopped after 6. However, there's a caveat to that because the last 2 cycles I've had, cycle number 6 and cycle number 7 yesterday, we cut the dose down. I've had a reduced dosage on my panitumumab and the fluorouracil, which is affectionately known as the 5FU pump. My panitumumab is at a 50% dose compared to what I was originally receiving starting on January the 7th. And my 5FU pump is at 75 to 80% of what we had before. That is simply because, as you guys know, I started to really struggle with side effects. And it's, I'm finally 7.5 minutes into this video, I'm finally getting to what I kind of thought was going to be the theme of the video. And that is the whole thing of risk reward, quality of life versus treatment, dosages, and frequency. And what I am learning through, I would say now it's hours and hours of conversation between my oncology professionals that I deal with. And I'm really fortunate right now. I've got my Mayo team, but I also have my local Minnesota oncology team here in the Twin Cities area, Burnsville, which is a suburb just next door. And they collaborate with each other. Minnesota Oncology is actually an official partner with Mayo Clinic. So I have got 2 sets of oncologists, PAs, CNPs, with lots of experience. And we, when I meet with them, we talk about the medicine and the technical aspects of the disease known as cancer. But we also spend a lot of time talking about quality of life and philosophy. And, you end up finding out, again, I think I've talked about this in previous videos, this is not cookie cutter stuff at all. Everybody is unique. Everyone is an individual. People respond differently to drugs. They also respond differently in terms of how they deal with side effects. I've mentioned before, I hardly ever have problems with nausea and vomiting. Not at all, really. I've had little bits of nausea, but I've never had a vomiting issue with my treatment. However, there's some people who are on the exact same drugs as I am, and they struggle number 1 with nausea and vomiting, diarrhea, stuff like that. I don't. My problems have been fatigue, low blood pressure, anemia, and still my red blood count, my hemoglobin was 10.1 yesterday, which, if you guys know the scaling, it's below normal. An adult male, I should have at least 12.4, 12.5 on my hemoglobin count. I'm down to 10, which is below normal, but it's not critical. But anyway, those are examples. And obviously the skin stuff, which is just tough, really tough. I mentioned before, my fingertips have not been as bad this time, but my scalp is awful. That's why you may have noticed I've been wearing caps. It's just my scalp blows up like chicken pox, and then it goes through these cycles where it will scab over, and then it will flake off, and it's like a snowstorm of scabs. It's disgusting. Spots of blood on my pillow every night, which is embarrassing. Oh, I was up, caveat, rabbit trail here. I was up in northern Minnesota. I forced myself to take a few days off. I had not been like out of town. I hadn't done anything fun since last fall. In October of last year, I made a couple of trips. I went down to Texas to visit my cousins, aunts, and uncles down there, and then also I met a friend in St. Joseph, Missouri, good friend of mine, Kurt. We had a little bit of a summit in St. Joseph, Missouri for a couple of days in October, but that was the last time I traveled. So I sort of splurged spontaneously and went up to the North Shore of Lake Superior this last week. Left on Saturday morning, came back Tuesday morning, midday, and stayed in a little motel like right on the North Shore of Lake Superior, north of Grand Marais. And the temperatures were in the 30s Fahrenheit. Some of you are watching from other countries where you don't use the Fahrenheit scale, but 30s Fahrenheit is barely above 0 Celsius. So it's still winter up there, big piles of snow along the lake. Anyway, the point is, I forced myself to get away and kind of have an adventure, because I hadn't, October is now exactly 6 months ago. And it was really a good thing. And again, it's, being healthy is more than just dealing with your medicine. It has to do with creating situations where you can have some enjoyment and some like glimpses of real life. And I'm an adventurer. I'm a road tripper. I'm a camper. I'm a hiker. I'm a nature guy. And even though it was only about 72 hours, it was fabulous. It was just so nice. But now I remember where I was going with this. I stayed at this little motel, and there were specks of blood on my pillowcase because of my scalp. And I was so embarrassed. I didn't say anything, but I just thought, gosh, whoever comes and cleans my room, they're going to be like, is there an axe murderer staying here? It's just like, it's humiliating to me that wherever I sleep, I did a video a couple months ago called Humiliations and something. Anyway, it was just about some of the things with my stoma bag and skin issues where I feel embarrassed and humiliated, because I think people that aren't familiar with stuff like that are just like, yuck, gross, what's going on with this dude? Okay, we're up to 14 minutes now, and I feel like I haven't even gotten to my point. This is definitely a rambler, this video. Sorry about that. But anyway, yeah, what I was trying to say is just that it's not only the treatment and the medicine and the technical medical aspects when we're talking about cancer. We're talking about very highly subjective, individualized quality of life issues. Certain people need certain things, certain people don't. We all have different needs, we all have different priorities, and that's why I'm grateful for my team at Mayo and locally here in the Twin Cities, because they are very concerned about how do we manage my treatment, but also make sure that my quality of life issues are intact. Because if all you're doing is taking medicine and dealing with treatment and side effects to just stay alive, for what? So that your family can worry about you? So that you can be miserable? That's not the way to live. And I think that everybody that deals with chronic illness, it's not just cancer, it could be, congestive heart failure, diabetic issues, orthopedic issues. As we know, there's a million different things that can go wrong. But okay, I'm gonna cut it off right here just because this is getting long enough and this has been rambly. But those of you who follow religiously, thank you that you put up with me when I get into these kind of like rabbit trail videos. You know how much I love you all, and I've been in touch with so many of you on a daily basis. I get texts and emails and comments just on the channel itself, and I love every one of you guys. Some of you are newer friends, and some of you are 40 and 50-year-old acquaintances, and even going back 60 years, those of you who are in my immediate family. So thank you for that. All right, I will stop, and I will see you next time. Bye-bye.